Sure
So,
about
yeah.
it's, they have pictures of us already. So either way, I know Kim has a lifetime account at Zoom for free. So I suspect we'll never be using Teams, which is fine. They all work.
Yeah, and so we're streaming live across multiple platforms from YouTube to LinkedIn to Facebook groups, also on our website as well. So we have multiple streaming options, and we are going to be going live on the radio in less than 1 minute. Colin is our amazing producer, and he may jump in to let us know over in chat what our timing, to make sure that we know how many minutes and seconds until break. And Colin, feel free to jump in and cut us off if necessary. Colin, would you mind raising your volume just a little bit so we can hear it?
I can do this, Dad. How's that right here?
I love that.
Our free mobile app, iHeart.
We're going to be starting in 5.
This AM, The Answer. This is 860 AM, The Answer.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation. 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group, thewaytomyheart.org, in partnership with Cardiovascular System Incorporated's patient advocacy campaign, Take a Stand Against Amputation. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kim McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Hi, everyone, and welcome to the Heart of Innovation. Every show this month is focused on a disease more prevalent and deadlier than all cancers combined, except for lung cancer. It's called peripheral artery disease, narrowed or blocked vessels in mainly the leg arteries that, if left untreated, can lead to heart attack, stroke, and amputation. The key is early diagnosis and early treatment, and patients can play a big role in improving their prognosis. The problem is, according to patients, that their doctors just don't spend enough time with them to talk about their options and how to become a better partner in their care. The Waytomyheart.org, a 501c3 that I run, which provides high-touch advocacy and support for PAD patients, conducted a poll of more than 200 PAD patients. On the number one response to this question, what is it that your doctors are missing or don't get about PAD? 58%, a whopping nearly 60%, wish their doctors would spend more time explaining their diagnosis and treatment options. Some of the respondents added comments, and the most frequent comment was having to go online to find information about PAD, checking in with Dr. Google because their healthcare providers are not giving them enough information. What do these patients want to know? Very simple questions. What does it mean to have PAD? What is the root cause of this disease? Why do I have it? How long can I live with it? That's just to name a few. Very simple questions that our guest today, Dr. Jennifer Avise, says should be answered during consultations with their PAD patients. And in fact, consult is one of the reasons she chose vascular as her choice practice area. So we're going to hear her story coming up in just a moment. Dr. Phillips, what do you think? Did we lose Dr. Phillips? Oh, we did. So I'll say hello to Dr. Jennifer Avise. Hello, Jennifer.
Hey, Kim, how are you? Thanks for having me.
How did you like the intro? A lot of truth in there, right?
No, you hit on the buzzwords, right, as partner in care, which is always, I think you're presenting it. This is what our patients look for in us. And I love when a patient comes to my office and says, hey, I'm invested. I'm curious. I'd like to know what's going on. Because then I know we can really start to have those meaningful discussions and get to some of the meat of this. It's a collaborative process. And I think as you and I were talking about before, it's not a one visit doctor's appointment. It's an ongoing relationship with our patients. So I think you hit right on it.
And I love it. And I know so many PAD patients that are listening in right now are going to be incredibly excited to hear more. But first, I think Dr. John Phillips, do you have a moment of inspiration for us?
Dr. John Phillips, spectacular vascular moment of inspiration.
I guess not. Our moment of inspiration will come, I hope, very soon. He's having some audio issues today, and we're going to be getting in. I'm sure he's going to jump in at any moment. But maybe, Dr. Avise, do you have a favorite quote that you can share and give us a little inspiration before we get started with your story?
Oh, I wasn't prepared today with a quote. I feel like his audio may be picking up.
I know. We'll try one more time. Dr. Phillips, are you there? Nope. So I'll share one. I had to MC this Global Girls in Tech conference over the weekend. And I mean, this past week. And it was so incredibly inspiring. And, that one moment that came out of this, and I'm going to carry it with me all the time, is the entire audience of more than 300 young aspiring tech entrepreneurs, is they shouted out this, I have a vision. I have a vision. And I think that statement is so powerful, whether it's, the doctor or even the patient. The patient has to have a vision of hope. And if you can get that patient to say, I have a vision, I have a vision of hope, I can see myself in my wellness, and I'm willing to reverse engineer every single aspect of my life to reach that vision. How powerful is that, Dr. Avise?
No, I think that's spot on. I always think when patients come to the office, they want to know, number one, what do I expect?
Mm-hmm.
What is this? What's coming next? We all like to prepare in our lives. And then number two is really, then what can I do about it?
Right.
So things can I modify? What can I change? So, what to expect and what can I do about it? You have to have a vision. You have to set your goals. You have to have, your own priorities, and then you can start to layer in these pieces. How can I affect my care? What can I do? What do I need from my team? How can my doctor help me? All of those pieces come together, but it starts with the vision, right? You have to have the goals.
It really does. And this information and what you're talking about right now is one of the reasons that you got into the vascular space in the first place. It's that opportunity to not just treat a patient and send them on their way, but to become a true partner with them in their care as well. Can we start a little bit from the beginning of your journey and how you started that journey towards becoming a vascular surgeon?
Yeah, it's interesting. I don't know how much detail you want, but to what we were talking about last night. So I ended up going into healthcare, actually initially thinking I was going to do some form of psychiatry because I really like engaging with other people, connecting, talking about their path. And then as I was progressing through medical school, what I realized is, I also really like to fix things. I really like to tackle a problem, to identify a problem, tackle it, and start to make progress on that. So ultimately that led me into a totally new sphere. So then I kind of switched over into the surgical mindset. Love surgery. Surgery is very neat in the sense that you have this very unique relationship with people where, somebody's in a very vulnerable situation. Their primary issues leading up to this were medical. So you're sort of using your medical knowledge, why disease happens, how it happens, and then you do this very physical intervention. So then you kind of get to use a completely different skill set to fix a problem or address a problem. And then from a patient perspective and from a clinician perspective, it's not just executing on that, it's kind of carrying that relationship forward through the process. It's so difficult. It's difficult. It's scary. And my former boss, Ron Dahlman, he always used to say vascular patients are in a very vulnerable position because the disease is recurrent and severe, and often our patient population has started to decline with mobility, with, activities of daily living, things like that. And so as I was progressing through my general surgery training, I loved being in the operating room, loved taking care of my patients. But then I started to think, I really like this long-term relationship, right, that I get to have with my vascular patients in particular. So maybe you have appendicitis, we remove your appendix, and that's awesome, and you live a good life, and I don't meet you again. But I like that kind of ongoing, long-lasting relationship that I can get with my vascular patients. And I really value that aspect of it. So that sort of turned me in the direction of that. Another, I think, really key piece of why vascular
back here on 860 AM in the heart of innovation. Don't go anywhere.
Leg health can indicate risk.
We ended up having to jump to
Clear on
break.
that side. Give me 2 seconds.
No
I'm gonna
worries.
get Dr. John through this studio here.
Well, we'll start with that whole thing. With that, this is a great story, and I love the detail in it. I think it's really fascinating, and I already see, one of our PAD warriors coming in with a question. Douglas, do you want to ask that on air, or would you like us to just answer it? We can call upon you if you'd like.
Whatever you'd like me to do.
Wow, I have way too much power.
all the decisions.
He is, you'd love talking to him. It's in the next, right in the after show, he's the head of our
Dr.
PAD
John, can you hear
Warrior
me?
Task Force. Yes.
I can
Oh,
hear
John,
you. Can you hear me?
yes, I can hear you now. John, are you there?
Okay, so here's the thing for everyone right now. I think with the way we're calling in with Dr. John right now, he can hear me. I don't think he can hear you guys right this second, but I know you can hear his voice.
No, I can't hear it. Do you want to tell him to call in on the regular number?
Oh, that's what I did. Hold on real quick. That's what I had him on. Go ahead, Dr. John.
Hello.
Oh, we got you.
I
Okay.
can hear you calling.
Yeah, he hear me now?
Can you hear Kim at all? Also, we got about 15 seconds till we air, but just to ask.
I can't now.
Okay, he can't
Can I
hear
call-
you guys right now.
Can I
Okay,
call
we're
in-
about to
is
be
there a
back
call-in number I
real
could just-
quick.
Can I call in the call-in number?
And okay, will he hear me on air?
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org.
Yes.
That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. We have been talking to Dr. Jennifer Avise. She is a vascular surgeon with Bass Vascular in the San Francisco Bay Area in California. And before the break, she was talking about her journey to becoming a vascular surgeon, how she started off wanting to get into psychiatry, and then she started learning that she'd like to fix things as well with her hands. And she started, moving towards vascular. And what she realized in terms of choosing, vascular over even general surgery is that when someone would have an appendectomy and have their appendix removed, that she would say, okay, great, I fixed you, you're on your way. And what she loves about the vascular patients is that she can actually develop a relationship with them and be a part of their journey and continue to see them evolve and help them evolve and improve their prognosis over time. And that's really commendable. And we're going to get to her in just a moment with more questions. I want to loop in Dr. John Phillips, who is here with us now and joining us via phone. Hey, John.
Kim, can you hear me? Can you hear me?
We can hear you.
All right. Yeah, just a little technical difficulty. just like you probably back in your days when you were, a roaming reporter. I'm out in the hinterlands of Columbus, Ohio, at a soccer tournament. So please forgive me. I'm sorry, but I was able to hear you guys, and I was listening. So it's a good conversation thus far.
It's fantastic. Did you want to share a moment of inspiration before we move on?
Yeah, like we had talked last week. Well, we did the Save My Piggies conference last week, and at that time we were doing a little memorial golf outing for my father, who passed away in May. His birthday was a couple days ago, and so I was going to use one of his quotes. He wasn't the most he was a pretty terse guy, but he always would say to me, "God helps those who help themselves." So that is the mantra that I was using this week, because we had a pretty busy service and then a lot of complex patients, and the wheels were getting a little bit shaky, but we were able to right the ship, and we treated a lot of folks this week, and it was a great week to be a physician. Just like you guys have been talking about, the ability to help people is really something special.
I love that. And this is the second time you've shared a quote actually from your dad. And it always seems so appropriate for that particular show. And this one, again, God helps those who helps themselves, because that's something that Dr. Jennifer Avise has been explaining why she absolutely loves being a part of the vascular specialty, because she can work with their patients. She is a partner in their care, and she works with them to be a partner in their care as well. And I think that that's absolutely perfect.
Well, and I was also wondering, to put you on the spot, but your mom passed away as well. Any thoughts, any quotes from mom that come to mind real quick?
My mom. Oh, she was the type of person, don't let anything or anyone get in the way of achieving what you want. You got to believe in who you are and what you desire, and know that if you focus there, you can have anything you want. You can make anything happen. And she was definitely that type of person. So I live that every day.
Can't let anybody get in your way, right? I mean, you just keep focusing, and you believe in what you want to do, you can achieve it.
And that's where, right before the show, we have one of our incredibly inspiring patients, Marcia, who is on our Zoom platform that we use to broadcast from here live on the radio. And she was talking about how she just ended up signing up for a 5K, and she could only go 3 minutes right now walking. The fact that she has this vision, right, Dr. Jennifer Avise, like, you have that vision, that quote that I shared in the first time, like, you have that vision, and you gotta do that, and then reverse engineer it and believe you're gonna get there. And then surround yourself with those people that are going to help you maintain that vision, help you maintain that focus, and help you get there, including your doctor.
Yeah, no, that's exactly right. I think, Kim, we were talking a little bit about this last night. Finding your tribe, as they say, finding your network of support is so important.
Yeah.
So it's one thing to say, I'd really like you to start a walking regimen. And then my patients will say, it's cold outside. Where do I go? Who do I do this with? And we all know this with every other aspect of our lives. It's so much easier to do this with a group that understands what we're going through and can kind of provide some of that support. So how great to do a 5K, right? You're with a bunch of people who are slogging it out together. So you get started, you make some connections, and off you go. And then, it's like one of those things, right? We'll measure the progress year by year, and I bet you're going to get your 5K goals, right? I mean, this is how it goes. You're going to have some good friends out of it.
I love it.
Network is so important, right?
And the interesting thing with 5Ks is that you do have different people at different levels with different reasons for entering the 5K. So you always have those ones that are looking to win it. But then I think the majority of people are right there in the center, just kind of plugging along, and they have a goal just to finish. But then you have this other subset of people that end up kind of bringing up the tail end that have so many incredible, inspiring stories as to why they're there. And it's a fight for every single step. And those are the ones that I like to watch because there is so much value, with every single move they make. And that moment they cross the finish line, the tears, in achieving that milestone means so much more.
It's the grit, right?
Yeah.
You have the grit
Good
to
word.
fight
Good word.
that you want. Yeah. It's admirable, right? It's good to see.
Yeah. So should we get back to your story? And I want to get to more of what you do to inspire your patients to finish that 5K in just a bit. But we should just go back because you were telling us right before the last break that it was great to perform remove an appendix, right? And send people on their way, great, fulfilling, but you wanted to build a greater relationship with your patients. That's why you chose vascular.
I think that's really important for me, it just meshed well with my personality, right? I like that relationship, but it is really important in what we do. And even a lot of our care is kind of coordinated with either a cardiologist or vascular medicine specialist, because it does take multiple areas of targeting this disease. So, one area may be simply surgical. And certainly I have that on my call weekends. Somebody has really gotten to the end of the road and we just go right to surgery, and that's what we do. But a lot of this, when I see patients in the office, and even when the patients see their primary care in the office, are opportunities for education, intervention, the patients to get optimized on their medications, and then also to start optimizing lifestyle habits, to understand what's going on, to understand why it's going on,
Right.
and to take on some of the challenges of how to start tackling this. And it can be really frustrating, right? Because sometimes it's identified on the back end. It's like, we've already progressed to having the disease, and now I have to backtrack and say, okay, now how do I develop these healthy lifestyle habits? And it's interesting too, we know that tobacco use, smoking, is a really big player. Just living in the environment of the US is a player, but a lot of this is genetics as well. So a lot of this can be a surprise to patients. And my family has a strong coronary artery disease, which is correlated with peripheral vascular disease history. And I like to think, oh, I took after my dad's side and I'm not affected. But we all feel that way, right? As we hope to be healthy, and then it can be really frustrating when you get confronted with, well, now I have this disease and now I have to deal with it. So I think that's where it's really good to link into our network and lean on support people. So it's that prevention phase, the after diagnosis phase. If we can get an early diagnosis, get people educated, get them linked into a supportive system, that's where we're going to see the best results. And I tell my patients, I really like to operate, but I hope that you don't need my services, right? Like, hopefully we keep it in the non-operative sphere. But I think that stuff is really important to people. And one
I
of
love that, because you're like, yes, I do love to operate, but you know what? I hope I never have to do that on you. I hope you're not that one. And coming up right here on the Heart of Innovation, I know you had one more key point you wanted to make on that thought, and we're going to let you do it. Leave everyone else hanging, and we'll see you back here in just a moment on the Heart of Innovation.
3 years ago, my symptoms started with
Everyone's clear.
Sorry, Jennifer, these breaks go quick, and it's like,
I
it's
know.
10 minutes and it always goes so quick. I told you. But Dr. Phillips is still there, right?
I am. I'm listening in. I hope you guys can hear me okay.
Do you want to take us in so that we can get you in there? Do you want to take us in from break? And I know, Jennifer, what you wanted to bring another key point in. Do you want to tell him what it is so he can lead into it?
Yeah, I think one of the neat things is the technology. That was the other thing that kind of drew me into this. So we have constant new technologies. And I think a really challenging thing as a patient, and you asking about PTAB was a great example of that. Like, when do we go for the new technology? When do we wait? I don't know. I don't have all the answers here, but that's one of the things that drew me into it is I think it's cool that we have constantly evolving technologies to address PAD. And I think
Yeah,
that's
and I
one
think that
of the common
that's the
questions
issue.
my patients, that my
And
patients
that's
are
the
like, do I do the new thing or do I not? I don't know. And
Yeah. And it's a constant like, which comes first, the chicken or the egg? Because when it comes to this new innovation, because you can't have evidence-based medicine unless you actually try something first. And this is just evolving at the speed of light. So it's like how, there's that big debate. Well, there's not enough evidence for atherectomy, but how are we going to get the evidence unless you have people doing it? And how do you create those guidelines unless people are doing it and developing those guidelines? And there's so much going into it. How do you know it? I mean, if it's, the same effectiveness as a plain old balloon, if you don't know if people are using it right and in the most effective manner, because there aren't those guidelines for the most part, if that makes sense. I don't know if I'm on
absolutely
mark
spot
or
on.
not.
Yeah, I mean,
Absolutely
it's
spot
an
on.
interesting. Yeah, it's an interesting dilemma in the sense that we have not, I think, cornered the market, which is good and bad. It's good in the sense that we're always trying to create new avenues or new, I guess, platforms of technology to try to fix the problem. But for example, in the coronary world, you pretty much everybody gets a coronary stent. They last for a really long time, and that's nice. But with like PQ bypass and some of these other things, you run out of the ability. You don't know what else to do, and so you try something different, and maybe it works, maybe it doesn't. Atherectomy is a perfect example. There is not a lot of great data to support its use, but anecdotally, we all use it for certain reasons, and it helps us in our cases. And you do also have patients who are asking about certain technologies because they see it on Google and whatnot. And so I always find it difficult to make sure I explain things as best I can and try to tell them to do the best I can for them with the best technologies that I have. And not everybody needs this, that, or the other.
We are coming back in 5 seconds, guys.
The answer. 8:60 a.m. The answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. We're continuing our conversation. And Jennifer, during the break, we were just kind of discussing some of the newer technologies out there to treat peripheral arterial disease. How do you have that conversation with your patients regarding, hey, we might try this, we might try that, everything's on the table? Do they ask you about certain procedures, or do you just kind of lay it out for them when you're talking about a potential plan?
I just try to provide as much information as I can. And it's interesting, to your point, as we were speaking over the break, it can be challenging because we don't necessarily have all of the data or all of the information on, what the optimal treatment is. And so we're moving from a field that's completely based on open surgical management, which is what we were doing, 30 years ago, into a field where, there's a new device, new stent, new technology on the market, every month, every couple months. And so, should we be an early adopter? Should we be a late adopter? I think we learned early on from kind of the historical aspect, the initial sentiment was like catheter-based surgery is not as good. So meaning a stent is not as good as an open surgery. And we're still having this debate today, interestingly, right? So we're seeing the results of several major trials that have come out is a stent in the SFA or a leg stent better than just a bypass surgery. So it's like we actually still don't have the answers to some of those things where we have data saying, maybe actually we're going backwards and an open bypass is better. So what I like to do in this kind of, I'm caught in the same milieu of, what do I do as the patient? And so I think the way to do that is to really make sure that we're tailoring our procedures to the patient. So we're really taking every single factor that the patient brings to the office and kind of incorporating that into how we craft a management plan, and that we're both on the same page. So I think there's just a lot of transparency in that. Sometimes that results in a longer visit. And I think sometimes that results in a little more frustration, because maybe sometimes as a patient, you just want to say, well, what's best? Let's do the best thing.
Right, right. A lot of my patients just tell me
Yeah.
what is best. And I always have to say, well, that depends on who you are. We just had a patient that was over in Ohio that she was an easy candidate for a minimally invasive procedure. Her blockage was not 100%, but she really liked her vascular surgeon, the one that she originally was offered the FemPop bypass, and decided, you know what, for me, I just don't want to worry about it for the next 5 years. We'll take it as it comes. 5 years down the road, if it blocks, then I'm sure technology will evolve. And that was her choice. And I said, it is completely up to you. I mean, there are minimally invasive options available. We do err on the side of trying that first without ruining a potential landing zone or a place where a graft can actually attach and reroute blood flow around a blockage. But why not at least try it? But for her, the bypass was right. So you have to give them the options and let them make that decision.
Well, yeah, I mean, and to your point, both your points, because they're excellent, you have to tailor the procedure or the plan for that patient.
Right.
And at the end of the day, what gets me is when the patient says, if it was your mom or your dad or your brother, what would you do? And that's kind of the philosophy that I've always used, because a lot of times, frankly, after the angiogram, I tell the patient, listen, I'm not going to do anything right now. We're going to use a conservative approach, and we're going to use some medications and a walking program. And if that works, great. If it doesn't, then we'll come up with plan B. And most folks, I think, gravitate towards that type of conversation. And like I've always said too, Kim, is I'm the coach here. The patient is the quarterback or the player. They get a playbook from me and some plays, and then I ask them to execute. And so they get to choose. It works most of the time, but I think, Jennifer, to your point, your patients can get a little bit frustrated because at the end of the day, all right, just fix me. And it's not just that easy.
No, I totally agree with that.
We're going to actually hear why she agrees with that and more of how she thinks the conversation should really go during a consult with a PAD patient. So stay with us right here on the Heart of Innovation.
Do you ever wonder why people with peripheral?
Oh, who's that sexy voice I hear? Is that Dr. Phillips?
You know where I was when I recorded that? I was at the DMV waiting in line to get some tags for my car, and I stepped out and I was whispering to try to do this. So yeah, I'm good. It was short and sweet. I'll just say that.
You're hilarious. You know, when you do a voiceover, you can also you can put your coat over you backwards with your phone in it, and it sounds like you're in a recording studio.
What's your coat? Did you say coat?
Yeah, you put a coat over the front of you, put it over your head over there, and then have your phone like right in the middle here. And it actually sounds like you're in a recording studio.
Ah, all right. Next time I'll do that.
It's my little secret.
The soccer team people will report him. There's this weird guy in a car with a coat over his head doing something. We're not sure what he's doing. Call security.
Well, there was a security guard in the facility, and he had asked me to actually get out of the hall because I was in a fire exit lane or something. So I had to go back into the back of a room to do it. They must have thought I was a real weirdo.
Like, this podcasting is strange.
Do you want to take us in from break? And she was just agreeing with you on your points.
Yeah, I'll take it back anytime someone agrees with me. So we'll roll with this one for a while.
Just give everyone a heads up. We have about 3 minutes till we're back on air.
Okay, thank you, Colin. Yeah, that would be great. And then also because I just want to give you every opportunity, John, to jump in. We do have a caller. We have Douglas who wants to ask a question about as patients, what can we do to assist our doctors in working together as a team? What is our responsibility that you wish we did actually better?
Yeah, that question. Let's get to Douglas.
But let's get to Jennifer agreeing with you, because that's a rare thing when someone will agree with you.
Yes, it is rare. Do it.
Which is great. So this is a 10-minute segment.
All right.
Do you know Michael Sia, Jennifer? He's a vascular surgeon. Oh, he's a cool young guy at UT Southwestern Medical Center. I absolutely fell in love with him when he fell upon one of our patients that was a patient of an interventional cardiologist nearby, Dr. Tony Doss, who's fantastic with legs as well. And we sent this one young patient in his 30s who had a gangrenous toe, some COVID vaccine issue, ended up with blood clots, likely attributed, maybe he had some sort of pre-existing condition we haven't figured out yet. But needless to say, he ended up at this podiatrist. The podiatrist said, you need to get in the hospital. I'm admitting you. It happened to be at a different hospital than Tony Doss, and it was at UT Southwestern with Dr. Sia. And I went to Dr. Sia on LinkedIn and I said, hey, this is one of our patients. He's with Tony Doss, blah, blah, blah. Would you mind getting on the phone with Tony Doss, because he was treating him? And he was so cool. He's like, yeah, here's my phone number. Give it to Tony and we'll chit chat. And they coordinated the patients. He ended up doing what he needed to do and then transferred him back to Tony. And I thought it was such a great relationship. And so now he has two amazing doctors. I just messaged Dr. Sia this morning very early with yet another patient, and he's responding right now. He's like, yeah, of course, send him my way. I was like, so sorry, it's Saturday morning. He's like, this is great.
Yeah.
Such a good guy. I love anyone passionate about limb salvage.
You have to have a good podiatrist.
Yeah.
SRN News.
How long?
8:60 a.m.
Oh.
The answer. Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Well, Dr. John Phillips and I are talking today with Dr. Jennifer Avise. She is a vascular surgeon with Vascular in the San Francisco Bay Area of California. And before the break, we heard her say that she actually agrees with Dr. John Phillips in his statements. I'll let you.
Haley's comment. Go ahead, Kim. Sorry.
No, I love that. It's true. We got to hear what Dr. Avise has to say and what she agrees with.
Oh, I just thought it was a great analogy, right? I will say our mantra is to treat every patient like they're your family. So when you're called at 2 a.m. and you don't want to get up, think, what would my mom need? What would I do for my mom? And it's really helpful motivation to get out of bed and take care of the patients and do everything. But I loved the new one that I hadn't heard before, was that the patient is the quarterback and you're just providing a playbook. And I really like that. I think that's so spot on, and maybe dovetails into some of our call-in comments. But really providing somebody with what I'm thinking and what my various treatment algorithms are is so important to me, because then I like to kind of use the patient as a sounding board and say, well, what do you think? How does this fit into your life? What are you thinking? If there's a clear-cut treatment, we go for that. I say, this is what I think is clear cut. This is really what I recommend. But some of these others are in the middle where we can do a variety of different things. And I say, these are the pros and cons to the various things, and we can kind of pick something together. But Dr. Phillips, I love that idea of the quarterback. I like it.
Yeah. Hey, I'm happy to provide. For me, it's just a way to try to explain something to the patient, because we have all this shared decision making now. And in fact, I was on rounds the other day, and now we're allowing some family members to be on rounds during when the docs are rounding in the ICU, which I thought was a little bit odd. But nonetheless, I mean, we're trying to engage the patients and their families with respect to, hey, this is what's going on. These are our thoughts. Help guide us a little bit. And along those lines, I think, Kim, didn't Douglas have a question that he was asking?
Yes, we have Douglas calling in, and I think Jennifer alluded to that. Douglas, what's your question?
It goes along with the whole story is today. How hard is it for y'all to manage everything that goes on every day? And on top of that, how aggravating can it be when we've heard stories of, as a patient, I talk to my doctor, I go out in the parking lot and I'm smoking a cigarette on the way home. So as doctors, what are some of the things that as patients we can do to help y'all better improve everything, if that makes sense? And how aggravating can it be when we're supposed to be walking, we don't walk. We're supposed to eat better, but I order French fries on a Zoom call. And
Yes, you did. They weren't for you. They weren't for you.
How hard,
Right.
as doctors, how aggravating can that be for y'all also?
Yeah, that's a great question. So I would tell you, I don't worry about the aggravation much at all. I would be the biggest hypocrite if I told you I wasn't doing a leg bypass at 2 a.m. and then eating a slice of pizza or a bunch of French fries. We're all, human beings in the endeavor, right? So I think we all, we know that, we recognize that about ourselves. So I think the thing really is to just make sure. I think the most frustrating thing for me is when somebody just doesn't care. So they'll say, oh, I'm just not invested. So anybody who comes to me and says, I'm interested in what's going on, I'd like some tools to do better. I'd like to make improvements in my life. You can smoke two packs of cigarettes a day. And if you're telling me, it's a bummer and I'm frustrated with myself about that, like, okay, that's a starting point, right? I'm not here to say that stuff is easy. That stuff is so hard. And that's a little bit about what I was excited to come on the show today for with Kim. Is I really like the idea of a network to help people, because it's like, how much can you and I really do in the office visit? If you say, I want to do better with my diet, I want to do better with my smoking, I want to do better with my exercise, we can say, this is your checklist, but now how to empower you to go out and do those things.
Right.
How do we bridge that gap? And that's something that our system, I would say most of my frustrations in medicine really relate to the system, right? Like I would love to push the easy button and say, hey, we've plugged you into a good system. Let's go. And I think this is where Kim and Dr. Phillips really have come up with something, hit on something good here, to kind of link people in, get a system going. Because, the meeting with your physician is really just the start of the hard work.
And it's also,
I would agree.
What is the conversation though that every vascular surgeon or vascular specialist, whether they're IR, interventional radiology, or even an interventional cardiologist, what is that conversation that they should be having, or what approach should they be taking with patients? Because so many of them end up with a 15-minute consult where they'll actually leave for 10 minutes of the consult because they get an emergency call or have to deal with something else, and they come back and they rush through a consult and offer the patient that is there in clinic only 5 minutes, and they can't get all their questions in and they leave disappointed. How can we fix that problem? Because I see that happening more often than not.
Well, if I may interject, so for example, in my clinic, we get 20 minutes to see a follow-up visit and usually 20 minutes to see a new patient. And you can't do much in that time because you have to spend a certain amount of that actually charting. And so the first consult is just answering a few questions. And then oftentimes we're calling them on the phone and my nurse is talking to them. And so this is just you're scratching the surface when you talk to that patient for the first time, and they do feel overwhelmed, and it's very troubling. I don't know how you fix it because it's a volume kind of based productivity system that we live in.
Yeah, and coming up right here on the Heart of Innovation, we're going to hear Jennifer's thoughts as well. So stay with us.
Saturday at 2 p.m.
Everyone's clear.
So do you know how long we have in this last break here of the show?
So this break right now, you have about 45 seconds till we come back, and then we should have a solid 5 minutes before we have to head out.
Okay. Great. And so Jennifer, and then we have the after show, so we can, it's more expanded. So you can, also, we have quite a few folks with PAD that are on the line here that probably have some questions for you as well. So once we get into that session,
I'll let you carry us over and out too. I just totally agree with that. We're a bit limited on our time. And really, I think when you called me, I was like, this is where you shine.
Actually, add 2 minutes to that. We have 7 minutes, so we need to get out.
Yeah.
We have how long?
Kim Max.
7 minutes. Hold on. We're about to go back live.
Sorry, I couldn't hear Colin.
The answer.
Dr. Phillips, you want to take us in?
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show.
Everyone.
Yep. Welcome, welcome, welcome.
Welcome's all around. Kim, take us back.
I want to jump right to Dr. Avise because we cut her off right before the break. Go ahead, doctor.
Yeah, I just wanted to chime in. I think one of the major frustrations is definitely the limit on time we can spend with our patients and how kind of our time is valued. And that's probably a story for another day. But I think this is where one of the really exciting things about Kim, your organization can shine a little bit is we can start the conversation in the office and then provide some resources. I send all my patients out with a list. It's a little typed out list of resources in the area. And it's specifically with this goal of trying to get people connected to start ticking off some of these goals on their own and learning on their own a little bit more before they come back for their next visit with me.
I love that idea that you actually give them a checklist. I mean,
Yeah,
that's
so
what
percentage of patients do you think actually follow through with that?
Oh, that's a good question.
Oh, that's interesting. And I think that's also regional and specific. I did all of my training in Atlanta and Emory. And I'll tell you, my patients were very different group than who I've managed in Palo Alto, California and Pleasanton, California. And I remember when I was first starting out as an attending, I was counseling a patient on diet and exercise, and the patient said, well, what do you recommend for a heart healthy diet? And I completely was at a loss. I had to just stop because I thought, I've never had this response actually where somebody wanted to engage with that recommendation.
Sure.
So I found some local nutritionists, and so now we link people in with the nutritionist, somebody smarter than I am to advise on how to execute a good diet, right? But it depends a little bit on people's engagement and how much they want to take ownership of what's going on and what they're able to do within their resource confines, which is really important. I mean, most people are trying to do the best they can, but maybe resource limited. So same thing as the operative stuff, you have to kind of tailor it to to each person and what each person is looking for, I think.
And I love that you ended up finding a nutritionist for them. That's one of the things we created at The Way to My Heart, some brochures that actively engage the patient. They help the doctor to be able to check mark on there. You have the checklist you give them. We created the checklist actually in a brochure that you can, hey, what are your symptoms? Where do you fall? Are you an intermittent claudicant, meaning someone who is early on in their disease and can do so much with medicine and lifestyle modifications to improve their prognosis, or are you a critical limb ischemia patient, meaning you've progressed to an advanced stage of peripheral artery disease and likely have some severe blockages that are causing pain that wakes you actually up at night. And, we have actually on this for the doctor to write in, what is this person's walking goal? What is this person's diet goal? And is there a nutritionist in the area that you can make a referral to? So many doctors say to eat healthy, but they never actually take the time to write the referral, which was required by most insurance, to see a dietitian or a nutritionist. So I love that you do that.
And
Yeah,
I've never
is a
written a
team
referral
sport.
for a nutritionist.
Well, now I think you're going to.
Now I'm going to. You got me.
I love it. Any final thoughts, Jennifer? We're about a minute till we are done with this particular broadcast. We're going to have you come back. There's so much to talk about with you. Would love your passion, love your energy, but share a few closing thoughts as we head out of the show today.
No, I think that was a perfect ending, coming to the idea that PAD is really a team sport. It's not just your patient. It's not just your surgeon. It's the other 5 people, 10 people that are collaborating to get us to the finish line.
Mm-hmm.
And I love that. I think that's a really important message to get out to folks, is it's going to be a team collaborative effort to get you the best care.
Actually, one of my greatest mentors, her name was Amy Mell. She was an executive producer for a show that I anchored. And she said, it's easier to work with someone than against them. And I've just brought that with me in every single role I have played. And it's so powerful and so true.
Yeah. And
Dr. Phillips?
I mean, join us, Jennifer. Make sure you have a quote ready for us, Jennifer, next time, because you never know when we're going to pop that question on you.
We love inspiration, those moments of inspiration.
We do. Have a great day, everybody.
I love it,
Thanks
guys.
so much.
Thank you.
Thanks everyone for joining us right here on the Heart of Innovation. We will see you next weekend. If you want more information on peripheral artery disease, make sure you go to thewaytomyheart.org.
Everyone on that side clear. You're good.
You've been listening to The Heart